one of those promos, and I think he made an attempt this year to get his spot back for next year. But yeah, Jazz was definitely a great deal for me. I think it was well executed, and my favorite performer, well, who I went for, people will not um people will say it's jazz and creole, but for me, I am a Bouyo fan.
Yeah, you're
And
excellent.
Signal Band, when they were announced on the lineup, for me that made it a very
Seal the
much,
deal.
yes, that sealed the deal. I normally go to jazz, and honestly, I normally don't pay attention to the stage, but this year I was all out for the, I call them now the big band, the youngest and the baddest,
Yes.
Signal Band. So that was it for me. I know, a lot of my contemporaries don't understand my Bouyo fascination, but I am a Bouyo fan.
Yes. I enjoyed the act of the Haitian lady.
Yes, Felicia Ross.
Yeah, she
She put
was.
on a good
Yeah,
show.
she did.
She
She
put on a
did.
good show.
And the fact that she could have sung so many different
Genres, yes,
music,
yes,
that
yes.
was very, very interesting. And the crowd was really into her.
Mm-hmm.
The saxophonist was very good too. The guy who played the sax,
Juicy.
I can't remember his name,
I
but I
didn't
think
catch
his
that.
parents are Dominicans.
The violinist.
Yes,
Yeah,
that's it.
black
Yes,
violin.
yes,
Yes, the violinist.
yeah,
Yeah, black violin was a unique act. And
yes.
I think they really engaged the audience.
Mhm.
And, they too, delved into different genres.
Yeah,
And once again, as a Bouyo fan, when they tried the Bouyo, that was
yeah,
it for me. They really catered to the audience that they
yeah,
had, which was Dominican audience. So they played all genres, your classical, they did,
yes.
hip hop set, and then it was the climax when they they tried a Bouyo, not tried, they executed a
Yes.
Bouyo piece. So Black Violin, I think, was a big hit
Really, really
at
good.
Jazz and Creole as well.
Really good.
Yes, definitely.
Okay, so just by way of advertising,
Mm-hmm.
Mother's Day is next week Sunday,
Mm-hmm.
right? I'm hearing so many songs already being played celebrating mothers, and all of us are always excited to celebrate our mothers, and
Yes.
of course, like the ordinary. Jolly's Pharmacy, we always do something to celebrate mothers.
Mm-hmm.
This year, we are having again a competition, and this one is going to be quite interesting. We are asking for at least 6 men to sign up. You could sign up at our pharmacy, any of our pharmacies. You call in and you sign up your name. And when you get there next week, Saturday, then you will know what the competition is.
So
But the
that
competition has 3 components.
so that's Saturday the
And
13th, Carlton.
yes,
Okay, Saturday
and
the 13th.
each component is a challenge,
Mm-hmm.
and the challenge will be timed. So in the times past, we've had men combing their
Combing hair,
daughters'
daughters
hair.
hair.
Then there was one with mothers.
Yes.
Men doing the mother's hair.
Yes.
All ingredients and
All the
products.
products.
Right.
Mm-hmm.
Right. The same thing is going to be applicable. So the items and products will be available,
Mm-hmm.
and there will be judges, and they will have to execute right there on the spot in a timely manner.
But
So
you're
we
not
have,
telling
we're
them
not,
what they have
we're
to
not,
do.
no, we're not saying no, because people start practicing.
Okay.
So we cannot tell them what they're going to do. Just
Okay.
sign up, and you will win some amazing prizes for your mom, and that is for your mom. So your mom will be the recipient of whatever prize you will have won.
Okay. So you're looking for 6 men to sign up.
6 men
6 brave men.
to sign up
Okay.
for that activity.
Okay.
Okay,
And where will we be doing
that's
it?
going to be at the Mega
At
Center.
Mega. Okay. My
Yes.
favorite location.
That's
All
going
right.
to be at the Mega
So at JP Mega, at Mega, 6 brave men,
Yes,
Saturday the 13th
yes,
of May.
yes,
And they will be competing for prize for their
yes. And
mom.
we always give good prizes.
Of course.
Always give
Of
good
course. And people know that.
prizes.
People know when it comes to Jollies, they can expect something good.
Yes.
So okay, I am intrigued,
I will
Carlton.
tell you.
I have some ideas.
I will tell you. Don't worry.
I have some ideas, but I think it will be very interesting.
It will be interesting to see the men sweat. You know, because sometimes simple things we take for granted, we see our wives do, you know, our mothers do,
Mhm.
and we never maybe took notice of trying to learn how to do it.
Mhm.
So we'll get the opportunity to be under pressure to do it properly.
Right.
And we will have
Okay.
some interesting judges that will inspect and see whether it's done the right way.
Okay. Okay. So 6 brave men. I'm looking
Yes.
forward to that.
And so if you can participate on behalf of your wife, who
Mhm.
is a mother. So if your wife is a mother, the mother of your children, you can participate
Okay.
in her
And win a prize for her.
Yes.
Okay.
You can participate for your biological mother. If you
Your-
have a stepmother,
Or your
if you
adopted
have
mother.
your adopted mother,
Mhm.
if there is somebody that you recognize as a mother figure in your life and you want to do it on their behalf,
Mhm.
you can do it as well.
And of course, you know, in our society, a lot of people were raised by their grandmother.
Yes.
So if you know
True.
that is also an option.
Yes, that's
Mhm.
also an option as well.
Mhm.
And as I said, you will be doing it in honor of that person, and so we expect the prize will go to that special
Okay.
mother. Well, the prize is because
Okay.
we opt to give free prizes. So first, second, and third,
Nice.
and these people will be a happier person come Mother's Day
Mhm.
on the 14th
14th of May.
of May, Mother's Day this
Mhm.
year. Okay, so what we're going to do, we are going to take a short break and then we will get right into today's discussion on health vibes.
St. Mary's chips, a chip for every occasion. It's go where good things happen. Craving a bite of something tasty but healthy? Then it's time to head to Jolly's Pharmacy and pick up some chips from St. Mary's. Cassava, banana, breadfruit, or plantain chips, the choice is all yours. All ingredients are fresh from the farm and it's healthy. There's zero trans fat, no MSG, and it's gluten-free. So when you're making those healthy choices, always choose St. Mary's. St. Mary's, where good things happen. St. Mary's chips, a chip for every occasion, made with love in the Caribbean. Distributed island-wide by Jolly's Pharmacy.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lango with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down King George Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and pick on any mission. If you see me again, Jolly's Pharmacy is number one, Jolly's working. We cater for everyone, Jolly's working. Boost up your immune system, Jolly's working. Yeah. We out Dominica, say by Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. With your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring Papa and Mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for store discounts. Check us out at the Mega Store in Funkole, where there's lots of parking. On Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. And on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we are back here with you, of course. Health Vibes on a Wednesday morning here on Q95. We always seek to educate, inform, and bring vibes, to topics of health, importance to health. And this morning we have a topic. I don't know, Carlton, if maybe some people might find it gross, but it's something that's very important to talk about and understand as well. I know in some of our previous episodes, we've spoken about certain signs that people may take for granted that may be indicative of a major health issue. And our topic today is no different. So I wanted to preface the topic with, throwing out to our listeners, how often is it that when you use the bathroom and you urinate or you defecate, you look at what is in the toilets? How often do you do that, and do you think it's important to do so? So what we're going to be talking about today is your stool, defecation. When you release that stool, what signs may be apparent in it of your health? And particularly, we're going to talk about if you see blood in that stool. So Carlton, that is the first thing. Are people supposed to be looking at their stools when they release?
Definitely.
Yes.
The answer is a big yes. And all of us should be doing so. And I can take it further to even see our underwears. We can look as well inside of our underwears when they're taken off, and that can also indicate what's happening to us. So if you, let us say you're wearing a white underwear and all of a sudden you're seeing a brownish stain where your penis supposed to be, your vagina supposed to be, and you're wondering, where is that brown coming from? Why am I seeing this brown secretion mark on my underwear? The same thing applies to the back passage. And so the looking at your underwear can indicate many signs and symptoms of medical conditions that are occurring inside of your body. And the same is applicable to looking at the waste that comes from inside of us in the toilets, whether it's our pee, whether it's our stool. That is very, very significant. We shouldn't be grossed by our stool per se. Oftentimes, I may be grossed by somebody else's stool, but my own stool, nah, I'm not really grossed by that, because you have that private moment when you are in your toilet. Most people have their phones in their hand as well. Many of us are not grossed to use somebody else's phone, knowing that we may not even know that they may have used that phone in the toilet, and you don't know under what condition they may have held that phone. And we hold phones from time to time, people's phones, people's books. People use books and magazines when they're there, and oftentimes we don't think gross using them or touching them. But when it comes to our stool, some people feel like, why am I looking at, why do I have to look at it? But it is important to look at it.
Definitely. And it's something that I will reiterate. I think I have said it, and we have both said it on previous, shows, but it always is important to know what is normal for you, your body. And so therefore you can decide or decipher when something is not right. So a lot of people, if you're not observing, your bowel movements, even in terms of, yes, the appearance of the stool, what color it is, what consistency, etc. But what about the frequency as well? So if you're not observing how you normally are, then when something is askew, then you have no, you cannot even know. You cannot, you don't know what to describe. Somebody may ask you, how frequently, or how, what is your regular bowel movement, a doctor, and you cannot describe that because you're afraid to kind of, engage in knowing that aspect of your bodily function. So I think it's good advice. It's very important advice to always monitor all bodily functions that you have. Of course, the stool and what we're speaking about is a part of the digestive system. That is the end result of our digestive process. And so it is a good indication to us of how that particular body, that organ system, the digestive system, how it is functioning. Is it functioning appropriately, properly? So it's a good idea. And for other things too, how Carlton, you mentioned, when you look at your underwear, what is the discharge that you have, or your bodily smell, what is that like normally? Is there a difference? So just be very aware of your body and how it functions. So if something is wrong, you pick it up right away.
And I like the way you summarized this in the preview of our discussion, because blood in stool is a medical condition or symptom rather that is quite prevalent. We see as pharmacists, as you would know, people tend to come to pharmacists even before they seek other healthcare professionals' advice. So again, because the pharmacist is free, you don't have to pay as such to see the pharmacist. And so you know that the pharmacist has some knowledge of what's happening of the body and medicine. And so most times people will come to the pharmacist initially. I recognize when I wipe, I am seeing blood. When I poo, I'm seeing blood. They would normally say that. Oftentimes, when they do come to say so, it is extremely uncomfortable for them to say so. It is not something that the average person is just going to come delightfully and
say that,
engage to
right?
say. So
There's
it's-
some level of embarrassment and
embarrassment
discomfort.
that comes with that conversation. And then we will probe. So we may ask you how long you've been noticing the bleeding. What color is the bleeding? Is it dark? Is it bright red? Is it do you see blood clots? So we ask specific questions before, so we get an idea what's happening before we may recommend for certain procedures
Or treatment.
Yes. So there are certain things that we want to discuss. But as you did say, anything that comes out of our rectum is basically an indication as to what's happening in the digestive system. The digestive system begins in the mouth and it ends in the rectum. It's a long system. So your mouth, your esophagus, your large intestines, your small intestine, the stomach, yes, as well. And then you have
the rectum and then the anus, the exit. The mouth is the entry and the anus is the exit.
Right. And so we have that long system, and many things can occur from the mouth all the way to the rectum. And so it is one that can indicate many medical conditions that may be occurring there, particularly when a symptom such as blood is seen in your stool. And it doesn't matter whether the stool is soft or whether the stool is hard. Blood should not be in the stool. So that's one of the fundamentals, one of the facts. Blood should not be in the stool. You should not see blood in the stool at no time.
Right. So Carlton, let's go into why could somebody see blood in their stool, and if they see that blood and they see blood maybe one time, is that cause for concern, or should it be cause for concern only if they see it multiple times. So,
That's-
yes. So what is the cause of
That is
blood?
a good question that you've asked. Blood in the stool basically indicates that there is bleeding in the digestive tract. And we said the digestive system or the digestive tract begins in the mouth and ends in the rectum. And so anywhere, any part of that digestive system, if there is some type of injury, some inflammation, some microorganism that's not supposed to be there, some tumor, anything like that could actually cause bleeding. We can even get bleeding based on medications that we might be taking, lifestyles, a certain lifestyle. If you're a smoker, if you abuse alcohol, if you've had some levels of toxicity, if you've had an injury to the digestive system, all of these could be causes or possible causes of blood in the stool. So you may have what we call inflammatory bowel disease, or IBS or IBD, as it is called. So that is an acute or chronic inflammation that occurs in the bowel. And inflammation basically means there is swelling, there might be pain, and that in itself could cause either severe constipation or severe diarrhea and give rise to even bleeding. And so you would have to be assessed for that. You have what we call ischemic colitis. That is, again, where there is a blocked blood flow. So one of the arteries in there could be blocked and blood is not flowing very well to the colon. And so therefore you have a lack of oxygen, which can cause damage to the intestines. That could also cause obstruction, that could develop into buildup even of a blood clot, and even can cause a drop in your blood pressure. So again, that is another possibility of having bleeding in the stool. Bacterial infections. You may have eaten a meal that may not have been prepared or preserved properly. That could result in salmonella or E. coli. These types of bacterial infections can be very acute, and meaning they can be sudden. After having eaten that contaminated food, you can begin to see symptoms mere hours after. That could even result in hospitalization. We've seen it in conditions like cholera as well, which is highly contagious and can be quite fatal because of the complication of dehydration that it causes. So again, bacterial infections is one of the causes. And when we talk about bacterial infections too, I should also include protozoan type of infections like Geriasis and Ambriasis. And those are infections of the intestine system, the intestines, that oftentimes people may have and not know. So that is basically caused by an overgrowth of parasites in the colon. So that is why using antihelmintic
what we call worm medicines
are essential, particularly if you live in the tropical countries. They call tropical diseases. We are more prone to having an imbalance or an overgrowth
of those parasites, yes,
in our colon.
Yes. Carlton, I want to interrupt you. I mean, I don't want to stray too much from the topic, but as it relates to your worm medication or the possibility of parasites, being in your digestive tract, the intestines in particular, how frequently should someone take worm medication? And is it something that all of us here living in the tropics should take, or is it only if you feel like you have some symptom of what we call, you have worms, you maybe have a loss of appetite, or some people say you have increased appetite, you're eating too much, you maybe have worms. Or some people think, although this is not a little wrong, this is wrong, that because you're eating fruits, like it's mango season, you'll get worms. But that's not the origin of those particular worms that we're talking about. But yes, Carlton, should you just be taking that worm medication regularly, or is it only if you feel some sort of symptom?
I like the question because people are always quivered when they're told that we all have worms, parasites in our GI tract. They have a function, and their function is to break down foods, and to sort of, it's like having earthworm in the earth.
In the soil, right? To aerate the soil, make those little holes, and
right, and they help with the whole
decomposition process.
The very same thing with the worms in our GI tract. And that is where, when we had the Mbama last week, and he spoke about that when we swell when we die, and then the abdomen bursts, and that's when the worms, if you've seen it in animals, the worms normally start from the GI tract, from the mouth and the stomach. Because this is the area where you have the most parasites and bacteria living in that particular system. Now, worm medicines, we recommend that worm medicine should be taken at least twice a year, every 6 months. Particularly why? One, we consume a lot of vegetables. Vegetables are one of the food groups or food types that harbors a lot of parasites. So because we consume a lot of vegetables, again, we might be prone to parasites. Lots of our food items comes from the earth. Again, they're exposed to parasites. If we consume a lot of pork, I know many Caribbean people, including us, we like our pork, and pork is one of those meats. It's it's a rodent, and so it falls from the rodent family. The same thing, rabbits. They come from that same family, and so they do have a lot of parasites as well. And so people who consume a lot of pork, they are recommended, or pork products, they are recommended to take worm medicines at least 2 to 3 times a year.
And the cooking is important to you, Carlton, because particularly in meat that is pork that is not properly cooked or not fully cooked, those parasites may still be alive when you consume it.
That is very true. So again, a lot of the times, especially in our women and children, one of the first medical complaints that you will hear is that the child sleeping a lot, or the child always tired. The child is not learning very well at school. The child is very picky with what he or she eats. And when the chemistry is done, you may see anemia being presented. And when you further investigate, you realize that the anemia is really iron deficiency anemia that is caused by the overgrowth of parasites or worms in the GI tract. So if there is an overgrowth of worms in the GI tract, it can actually cause iron deficiency anemia. So for the many people that would have had anemia, you have different types of anemia. You have megaloblastic anemia, pernicious anemia, iron deficiency anemia, sickle cell anemia. Right. So you have different types. But the one that is more likely linked with worm infestation is iron deficiency anemia. And we see it in children, particularly in children, and women, even women who are pregnant, because a lot of the times when women are pregnant, they have a lot of weird cravings. I've known of women eating dirt. And for children who consume, women and children who have cravings for dirt, what we call pica, right? These weird cravings, you again are exposed to parasites as well by
Mhm.
consuming dirt.
Mhm.
And so that is something you want to be aware of.
Okay. So we're saying in general, 6 months, every 6 months we should be dewormed.
Yes.
And it's easy now, Carlton.
Yes,
You know,
it's
the dewormer
easier,
is
much
easy.
easier.
You can just take for me, a Zentel
Yes.
tab, and that's okay.
Yes.
I know in the past, like my mother would give stories how they'd
Oh,
make
I
her drink
experienced it.
Sene,
Yeah.
and the taste is so bad, and but now you just pop a
Yes.
tab, and it's
That's true.
easy.
And before time, in the 80s, you would have seen the live worms coming from your rectum. And it
Mm.
really scared a lot of people because you'd see, and in those days you had pit latrine, and so
Oh wow.
you really, and most of us would have, many of us who grew up in the early 70s, like myself, without flushing toilets, people dug holes in the yard and defecated there, and you would see these live parasites. And so it wasn't anything easy to encounter. But with the advent and advancement and innovation of medicine,
Right.
the worm medicines now, they crush the worms.
Kill them so you
And
don't
so
get
you
to
don't
see them.
You
Right.
don't see that.
That's a definite improvement.
That is an improvement. So we're
Yes.
talking about some of the other causes,
The causes,
as well,
yes.
of seeing blood in your stool.
Mhm.
You could also have
Diverticular
disease,
Mhm.
what we call diverticulitis,
Mhm.
right? And that is basically tiny patches that stalks out of the colon wall. And it is something that, again, that is very common. We see it more in obese people who are overweight and obese, people who force a lot to defecate.
Mhm.
So if you're forcing a lot to
What we call
defecate,
straining.
it's straining.
Mhm.
If you have a poor diet, so
Mhm.
your diet doesn't have enough roughage or fiber, you consume a lot of let's say flour.
Mhm.
You're not consuming enough whole grain, you are more likely to experience that as well.
Mhm.
Hemorrhoids is another major cause, and we do see a lot of people experiencing hemorrhoids, which could cause bleeding, and oftentimes the bleeding can be very bright in color.
Right. Carlton, I was going to ask that. What about the right? The color would be different from
Yes,
a
so
hemorrhoid as
that's
compared to if you maybe have irritable bowel disease
Or peptic
or
ulcer.
an ulcer. So
Mhm.
the location of the bleeding
That's
would
true.
determine the color of that blood.
That is
right?
very true.
Mhm.
Very true. And again, that is why we do not want you to stay home and sort of nurse or to go on to Dr. Google and get paranoid, because you might see, well, it's a sign of cancer, and you're going crazy telling yourself that you have cancer, you're going to die. And when the assessment is done, it is something much simpler than what you would have thought. And
Mhm.
we don't want you to be overly anxious for nothing, self-diagnosing. So that is something that we want you to avoid doing, but rather go to your medical doctor. And if the need is warranted, they will send you to the gastroenterologist, because we
Right.
do have
Yes.
gastroenterologists. And sometimes the gastroenterologist will refer you after they diagnose your condition to the surgeon,
Mhm.
if it's something that has to be done or dealt with surgically.
Mhm.
So these are some of the processes and the steps that goes. So
That-
you'd see your general practitioner.
Mhm.
Based on what the preliminary result shows, that practitioner may refer you to the gastroenterologist.
Mhm.
That is the specialist that deals with the matters of the stomach,
The gastrointestinal
the
system,
esophagus,
yes.
including the liver as well. And then once that speciality or specialist would have assessed it, if it's something that requires surgery, then they would refer you then to the surgeon,
Mhm.
and then the surgeon will do whatever they have to do. If it's something now that is cancerous, then after the surgeon has dealt with you, you now go on to oncology.
So right, so the oncology.
Yes,
So good.
yes.
So this brings me to the next question, because when you mentioned Google, Carlton, I was going to ask you, what about blood in stool and a possible association to some form of cancer? Is that possible? Because oftentimes when you Google something, cancer is maybe the first thing that pops up. A lot of people will tell you, anytime they Google a symptom, they have cancer, according to Google. So is blood in the stool a possible symptom of some form of cancer?
It is a possible symptom of some form of cancer, but the investigation has to be a bit invasive in the sense that you may have to do a colonoscopy, you may have to do an endoscopy, you may have to do a barium X-ray, you may have to do blood tests. So it's not just looking at one symptom and saying it's cancer.
It's cancer, right?
There has to be further assessment that would involve investigations and even invasive procedures like an endoscopy or colonoscopy
Yes,
as well.
Yes, and for the listeners who maybe, because this is interesting, Carlton, for the listeners who maybe have not experienced, such a procedure, or who don't know what we're talking about, for the colonoscopy, a tube is inserted into the rectum that has a camera at the tip. So inserted into the anus, and that tube can go all the way into the intestines, and the physician, the person who is doing the colonoscopy, can therefore visualize the intestines and what's going on. And it is recommended after the age of 50 that you should have a colonoscopy, and then I guess the regularity of that procedure, you would get advice from the doctor as to how regularly you should do it. But a lot of colorectal cancer, a lot of cancer of the colon in the older age groups, so that is recommended. And the endoscopy you spoke about, Carlton, this is one I've done myself, where or gastroscopy, where that same tube, not the same tube, but a tube with a camera at the end, inserted into the mouth and goes all the way down the esophagus into the stomach, so the doctor can look at the stomach. And I can tell you, it's something I have done awake. I opted to do it not under anesthesia. And it is maybe, for me, honestly, the worst experience I had in my life. I thought I was dying, but I don't want to say it like to dissuade anyone. It's necessary if there is a potential issue in the digestive tract, and the doctor needs to visualize, the gastroenterologist needs to visualize the digestive tract, or else will they know, what's going on. So I opted to do it awake, but I think I would recommend for other people to maybe choose to do it while asleep under anesthesia. That's my recommendation.
Should he? I believe you are way stronger than I am. I attempted once to do it awake, and that was many years ago with Dr. Fadipi, and I could not have gone through. The second time I did it with Dr. Sanchez, and I did it asleep.
Asleep, yes.
And even being asleep, Dr. Sanchez said I was still kicking.
Gagging, okay.
So can you imagine? So, yes, we have a caller. Let's take this caller. Good morning to you, caller. Thanks for calling.
Carlton,
Yes, good morning to you.
morning to you and morning to
Trudy.
Before.
Trudy. Mrs. Defoe is not with us today.
Oh, she's not with us. Sorry, my apology. Good morning to her and good morning to your listeners. In fact, I did it in my mouth through my stomach on 3 different occasions. It's very uncomfortable, I'll tell you that. It's uncomfortable, but when it comes to your health, nothing is too uncomfortable for your health. And if I have to do it again, I will do it again. Which I plan to come and see you very soon, Carlton.
Okay, no problem at all.
Take care, God bless.
All right, have a good morning. Okay, we have another caller.
No, we lost that.
Okay,
Yes,
yes.
we do.
Good morning to you, caller. Thanks for calling. Good morning, caller. Good morning, caller. Okay, so we've lost this caller. But we want to go on because it's a very tutorial educational session we're doing today. So I would really want you to take some notes. If you, particularly if you are someone that have seen blood in your stool more than once, and you've basically remained silent, and you're saying, okay, let me monitor still. Maybe it's not something serious. Maybe something I drank. Maybe something I ate. Maybe the peppery food that I had last night is that do that to me. And so therefore, I'm not going to go to doctor yet. So if you are making these excuses, I really want you to listen attentively and to take some notes.
Carlton, and we had an interesting question / comment, coming from one of our Facebook listeners, who asked if you observe the blood in your stool for many months and then suddenly it stops without you having done anything, what does that mean? Or I guess, should you still be concerned? So what about that? You were observing the blood for a few months, and you did nothing, and then it stopped. Should you still want to do an evaluation?
The evaluation still needs to be done.
Okay.
Because you really don't know what is causing the bleeding. And what if it's a tumor that is there, and the tumor has grown so much that it's actually blocking even the blood from flowing? All right. What if it's a blood clot that is forming there? And so we spoke about some of the other possibilities. And so that's why it's important to have the investigative diagnostic procedures done to really confirm where the source of the bleeding is and what can be done to intercept and control that bleeding. One of the things that are very common too is anal fissures, and that is where you have a small tear in the mucosal lining of the anus. So we know that the anus is very rich in blood vessels, and it's very easy to get torn, particularly if you force to pass stool. For those who may engage in anal sex, that as well could also be a possibility for you having an abrasion of the mucosal lining of the rectum or the anus. For people who use objects in there, that could also be another, particularly if you don't use enough the right lubrication, that could also be a factor too. So having that small tear within the lining of the anus, that could cause some bleeding. And usually it can be very, very painful because of the inflammation that this tearing causes. And one of the precautions that you want to take, because you have a tear, you have the cavity or the mucosal lining is open, you have stool matter or waste coming out from that, which is rich in all types of microorganisms, fungi, protozoa, and bacteria. You can end up having major secondary infections. And so it is not a condition that you want to leave unchecked,
right?
Because you could end up having major problems. And so one of the problems that you can even develop, which is a bit more complex, could be septicemia.
Okay.
Where you could have microorganisms like bacteria getting into
your
your bloodstream.
Okay.
And so you want to be very, very cautious. If you have noticed that you may have a lot of pain in the rectum area, but you could also have pain in the rectum area that could be caused by herpes simplex virus type 2.
Right.
You see, so
I was going to
yeah. So then that's why the examination
is
has
important,
to be
right,
done, so that the doctor can actually narrow down as to what exactly is causing the pain. Because I know of people having herpes simplex virus, which can you have the pamphules, and then afterwards when they burst, they can be very, very painful. And so that in itself is viral by nature and could cause a secondary bacterial infection. But let's take this caller. I saw we have another caller. Good morning to you, caller. Thanks for calling.
Good morning, Carlton, and good morning,
Good morning to you.
Christian.
Good morning.
very, very, very important conversation today.
Thank
I
you.
must tell you all that.
Thank you.
I'm there and I'm listening and I'm saying, wow, you have a lot to ponder upon.
Thank you so much, caller.
And only thing you were missing on Sunday was your gun belt and your boots.
To be a cowboy.
Yeah, the cowboy there.
Thank you.
Anyway, take it easy so you enjoying yourself.
Thank you so much, caller. Thank you. We have another caller. Let's take this one. Good morning to you, caller. Thanks for calling.
Morning to you, Carlton and Trudy.
Yes, good morning. Good morning.
Hey, I'm listening to the conversation, and again, I always like to commend you and your crew on the kind of information you're putting out. Hopefully, the public is listening and taking in the lesson. But Carlton, you mentioned diverticulitis early on, and I wanted to add to that part of the conversation, because somewhere I read, I was listening to a program and then I went to Dr. Google reading something about what you call this, a thing they call leaky gut syndrome. And somewhere in the story they mentioned, again, it's what you put in your mouth a lot of time affects the end result of your health. And they mentioned drinking a lot of pot sodas. I don't know if it's the acid in the drinks or the sugar or whatever, it's a combination and what these things. They say, but a lot of people who drink a lot of these things, I'm not sure in other places, but they mentioned in the United States, suffer from the leaky gut syndrome. And you also said in obese people, and there was a lot of that related to the obese folk because of the I guess the carbonated or whatever. So I'm just dropping that one in there so you might know, because you educate to elevate, and I'm willing to go up higher with the knowledge.
Thank you.
I'm listening. Thank you.
Thank you, caller. I'm
Thank
trying
you.
to look at the time there,
Yes.
so that we can speed up a bit. But also too, if you suffer with peptic ulcer, that is something again that has to be diagnosed. With peptic ulcer diagnosis, you have to do an H. pylori test, Helicobacter pylori test. That is usually done for a stool culture or blood test. Most doctors would do the stool culture because it's much quicker. So once you have an H. pylori positive, that could indicate the diagnosis of peptic ulcer or duodenum ulcer, and you would be given medication. So if you have a bleeding ulcer, that could also be a cause. Colitis, which is inflammation of the colon. If you have colitis, that is also another factor as well. If you have cancer, and we mentioned cancer earlier on, that is also another factor or reason why you may be seeing blood in your stool. Esophageal issues, so you may have esophagitis where the esophagus is inflamed because maybe you suffer with good gastroesophageal reflux disease, or you're a smoker, or you abuse alcohol, or you take you may have taken a weedicide or some type of toxic agent. That could also cause esophagitis. So people who would have attempted suicide, maybe using a weedicide, a pesticide, or even a detergent, like bleach, something like that. That could also be the cause as well for having bleeding in the stool. So we want people to be aware of that.
Right. Carlton, I just wanted to backtrack quickly. When we were speaking of anal fissures or those tears in the mucosa of the anus, and you started speaking of another possible cause of pain being herpes, right? But I just wanted to also insert here, anal fissures also make people more susceptible, or those tears in the anal lining, to sexually transmitted infections if they are engaging in anal sex. So therefore, if you do observe that blood and it is as a result of tears in the anus, you need to be particularly careful in terms of sexual activity. So utilizing condoms, and or utilizing, make sure that that area stays safe, because you mentioned secondary infections from bacteria. Of course, we can have secondary infections coming from sexually transmitted infections as well. Your particularly what we want to avoid, our viral infections.
Definitely.
Right.
I also wanted to mention too, the new guidelines from the American and British Gastroenterology Association is now indicating that colonoscopy should be done at the age of 45.
Also, they lowered the
Yes,
age. Okay,
rather
so
than
I had said
50,
50,
yes.
so 45.
Because of the spike of
Colorectal cancer. Okay.
these days. Yeah.
Good.
So they're saying now that once you have reached the age of 45, you should begin to screen, particularly if there is a family history
Right.
of stomach cancer, colorectal cancer, these types of cancers. You should get screened.
And that's important because you see how guidelines change over
Yes, it
time. So,
changes.
now the guideline is lowered to 45. You might just save your life if you
That's
start
true.
earlier with
Right.
your screening.
Right. And some of the symptoms, or that some of the associated symptoms that are familiar or associated with blood in your stool, you may experience fainting, you may experience weakness, and you may experience palpitations, weight loss, and all of these are basically due to the anemia. Because if you lose in blood, your blood count will drop, your HBC, your hemoglobin will drop, your red blood cell count will drop, and that's not supposed to be happening. So you may experience palpitations, fainting spells, weakness, loss, weight loss, difficulty with breathing, or what we call SOB, shortness of breath. You may experience, some people may experience vomiting because they feel nauseated, and you may experience stomach pain as well, or abdominal pains. So if you're experiencing these accompanying symptoms, along with the
Bleeding.
the bleeding in the stool, you should certainly have it checked. Let's take this caller. Good morning to you, caller. Thanks for calling.
Yes, thanks for calling. Carlton is talking about blood in
the stool,
when you
yes.
go to the washroom. But I would like him to talk about the pile.
Well, I did mention hemorrhoids.
Hemorrhoids.
This is
Pile,
Carlton you're
because
speaking
some
to.
people say
This
they
is
have pile, and when they go out, they pass blood in their urine, in their,
In their stool.
Yeah. We did
their
mention piles or hemorrhoids as one of the possible causes of passing blood in your stool. However, you have to get diagnosed. You cannot just assume that you have a hemorrhoid. It has to be diagnosed. And so that is why it's important because you could have internal hemorrhoids and external hemorrhoids. So all of that has to be assessed before the diagnosis is made. And once the diagnosis is made, the relevant treatment will be given. Let's take this other caller. Good morning to you, caller. Thanks for calling. Good morning, caller. Thanks for calling.
Hello, good morning, sir.
Yes, good morning to you, ma'am.
Okay. I was going to ask you about the laxatives. The citroma, I noticed, is off the shelf. Nowhere has that citroma, and it's a laxative. I don't know if they remove it altogether or if it was causing any difficulty. What do you think of that?
Okay, all right. So she's asking about citroma, which is a stimulating laxative. Citroma was pulled off from shelves all through the world because there was a contamination issue with citroma. So there was some microorganism that was in the citroma and it was recalled. So currently it is unavailable. And once it is brought back by the makers, it will be available again. There are other stimulating laxative that can be used, such as Sana or Sene, what we call Sene. You can use Sene, you could use Bisacordial, or you could use Bisacordial, and you could also use Cascara. Those are other stimulating laxatives that are available locally on the market. You could also use milk of magnesia, which is magnesium hydroxide, which is also a stimulating laxative, and that can also be substituted as well if you need to use a laxative. Okay. However, I should note that the abuse of laxatives can cause colitis. So it can cause acute inflammation and chronic inflammation of the colon. And so there are people who use laxatives to lose weight. You know, they want to use, they take laxatives so that they can lose weight, especially in the Spanish community. That's a big practice. And so we want to advise you to be cautious if you are one that may be practicing that particular
practice
habit. Yes.
Carlton, I see because I'm monitoring our Facebook audience, and that there's a question coming in about the frequency of the colonoscopies, which we were just discussing. So I just wanted to address that.
I can speak on that. Yes. So if you've done a colonoscopy and the doctor, the gastroenterologist recognized there is no polyps, no tumor, no bleeding, everything is fine, it is recommended 10 years after. Okay. If there were polyps, normally what will happen is that the doctor will take tissues from that to do a biopsy at the same time. So they will take tissues from the polyps and send to the lab to do a biopsy to find out whether the polyps may have cancerous cells in there. If the result comes out negative, that it's not cancerous, then they will use other medical procedures to actually remove it, sometimes surgery to remove it, and you should be fine. Then they would advise you on making changes to your diets. One of the things that is often recommended, particularly when polyps are seen, is reduce your meat intake, especially red meats. All right, reduce your meat intake, reduce dairy products, reduce sugary foods, because sugary foods produces more inflammation. So one of the things that I have been advocating, we don't have to wait for these diagnoses for us to make these modifications. Act as if you have the diagnosis. So that's what I was saying to somebody. I'm acting as if I have diabetes already. I do not have diabetes, but I'm living a lifestyle like someone that is battling or dealing with diabetes. When you have that mentality, you make better and wiser lifestyle choices. And so you look at your carbohydrate portions, you look at your food groups better, and you make wiser choices as to what you should be consuming, how frequently you should be consuming that particular food. I see we have a caller. Let's take this caller. Good morning to you, caller. Thanks for calling.
A question I wanted to ask Carlton and Tuti. How often should someone be taking laxative? And I'm so sad that Citroma is really out of because for years now we're not still Citroma, and that's the reason why.
Yes.
How often, like Senna, how often should someone, especially adults, be taking Senna?
I like that question. That's a very good question, because that's a question that pharmacists get practically every day. Laxatives, the body, let me see that one, and people take laxative for all these reasons, and these are not facts. So they'll tell you their blood dirty. Okay, they want a laxative to clean their blood.
Like a clean out, a wash out, they call
blood
it.
Is dirty. So your blood cannot be dirty unless you have a diagnosis of septicemia. Right, where bacteria gets
infection,
into your bloodstream, and that happens. That is not something that just happened like that. Okay, so you don't have you cannot have dirty blood. Okay, so you do not need a laxative for that. A laxative basically works in the gastrointestinal system, more specifically the intestines. So what it does, it removes the excess stool from the colon, and the colon, and you pass it out. Now, the body can naturally have its diarrhea. So sometimes you might get up and just have an acute diarrhea that may just last for a few hours and it goes away. Sometimes it could be viral. Usually viral diarrheas, they don't last very long. Bacterial and protozoan, they tend to last much longer. Protozoan in particular could last up to sometimes 3 weeks. And that is why it can be so dangerous. And so if you have a protozoan infection in the colon, then a stool culture will be done. The doctor will do a stool culture. Once it is confirmed, they will give you drugs like metronidazole or Flagyl or tinidazole, this kind of anti-protozoan drugs.
Okay.
They will give you this kind of medicines to treat it. If it's bacterial, we sometimes use things like Septrin or Cipro, for bacterial type of infections. But based on the question that she asked, how often should laxatives be used? Very sparingly.
Right.
You don't really use laxatives just
assume-
because you feel like you want to do that. So I would normally use a purgative maybe once a year.
And I would assume it's only if you're constipated that you would need to use a laxative. And if your diet is such that, you drinking enough water, you're taking in your vegetables and your fruits, constipation, can be avoided with that type of modification, dietary modification. So I don't know. I'm surprised of I was listening to you about the laxative use, and I'm surprised because I did not realize people use laxatives frequently, just like that.
And I will tell you something, Trudy. Many times people feel that they require laxatives. Many of these people they live a sedimentary lifestyle. So they don't exercise, they don't move around that much. They might be obese. If you're obese and overweight, you are more likely to have constipation problems too. Certain medications that you're taking. So let's say you're taking codeine, morphine, pethidine, this kind of painkillers.
Okay, so constipation as a secondary
you are
result.
more likely to get constipated from that. Iron as well. If you're taking iron pills, iron tablets, you are more likely to get, although some people do get diarrhea with iron supplements, but most people will tell you they get constipation. So if you're experiencing that, then in cases like that, your doctor may give you preferably a stool softener.
Okay, and not a laxative. Okay.
So they would give you preferably a stool softener, or if they do give a laxative, we would preferably use a bulk forming laxative or a fiber laxative like Metamucil, or tell you have prunes.
That's what we drink some prune
have
juice,
some prunes. Have some papaya. Eat more foods that are high in fiber. That is going to help you to use the washroom better. So, but to say just using laxatives, it is not advisable. For me, I would do my warm medicine. Let's say I take the warm medicine a Friday night. The Saturday night, I would take the purgative to just give me to just cleanse out the bowels, after taking the warm medicine. But I would normally do that once a year.
Okay.
Because I don't have constipation problem.
Okay.
So let's look at, you recognize being able to take a break.
Yes,
well, let's look at what can be done. What are some of the diagnostic procedures that are done
if you have blood in the stool,
or if there is bleeding in the stool? So again, as I said, the doctor you cannot come to the doctor, and a professional doctor, and I will say that, very keenly. You go to a doctor, there will be investigation. You will be asked, okay, you need to take off, you need to undress. The doctor may have to look inside of your rectum. It's not a nice feeling, but they may have to do that. Sometimes if you So then they have to push their finger inside of of your rectum so that they can see how much blood, what color the blood is looking like. You know, so there are certain things that they will have to do that may not be very pleasant, but it is necessary to do. As I said, they will send you for a special stool culture, all right, which you call an occult stool test. So they will send you for that particular stool test. When it comes in, they will be able to tell you exactly what's happening. They may refer you to do most of the general practitioners do not have the equipment to do the gastroscopy. So they may say, well, based on what is happening, you need to see the gastroenterologist. In Dominica, we have at the Dominica China Friendship Hospital, and we also have somebody in private practice practicing as doing gastroenterology. You go to see the gastroenterologist, the doctor might say, okay, we need to do, this is your results. Okay, your results are here. I'm seeing what's happening. We need to do a colonoscopy. We mentioned, truly explain what the colonoscopy is about. You may need to do a gastroscopy as well. So the doctor may have to push the tube by mouth and one through the rectum and exactly see what's happening there. You may also, they may do what we call barium X-ray. And that's where you have to drink something like a dye. You drink that, and once you have drunk it, it coats the lining of the digestive system. But you'll have to fast, and you'll have to use laxative to clean out your intestine. This is the colonoscopy. You have to clean out, so there should be no stool in there. But with that barium X-ray, you drink that dye, and what we call a contrast, and then they will be able to look and see if they see anything that's abnormal in there. Okay, so that is also done as well. They do laparoscopies as well too, where the doctor may open up the abdomen and look inside, do a surgical procedure and see what's happening there. They may do an angiography, and that is basically where dye is injected into your vein to make the blood vessels more visible for an X-ray or a CT scan. So they may do a CT scan as well. So there are procedures. So really and truly, you cannot sit at home and assume is something minor and rather ignore it, because it may be something very major that can actually even take your life.
Right. And Carlton, I want to say here that, it is important that we accept and appreciate when investigative procedures are done. It is not okay, because I know a lot of people want quick solutions. So they want to go maybe to the doctor and just get a prescription, or just get give me something for this. And without the proper investigative procedure being done, the doctor may treat you wrongly. You may receive a wrong treatment. And so to avoid all of that, just accept, the recommendation of the doctor to either do, whether it's the colonoscopy or whether it is to do some blood tests, lab tests, or any of the procedures that you mentioned, the barium X-ray, whatever it is. I know sometimes, particularly one, convenience or time, and two, cost, people want to avoid diagnostic tests. But I am a very big supporter of when a physician actually makes you go through the ropes of diagnostic tests. I want a physician that is treating me to be operating based on evidence that they have from tests that they have conducted, not operating based on, a guess.
I agree.
I don't want you to just guess is maybe that. I want to know, is that for sure? And then we go through a line of treatment that will best address that issue.
Right. I also wanted to mention too, you may see again the color red, bright red, or you may see dark red, where it's like blackish and almost making like a mucus, or you're seeing the blood clots in there. So if you are seeing black tardy stool or the black stool, which usually smell really, really bad, that basically is showing that the bleeding is in
high
the
up,
upper,
in the digestive tract
system. So we're talking about the stomach, the small intestines, okay,
Mhm.
or the right side of the colon. If it's bright red, right, like bright red, like almost like a shocking color
Yes,
red,
we should understand. That's
right?
fresh blood. That is
That's
from
it.
very low
Right.
in the
That's it.
digestive tract, the anus, particularly,
That's it.
maybe the rectum,
That's it.
Yes. And I think people need to really be aware of that.
That's true.
Because you should be able to conceptualize all blood and fresh blood.
That's
So
true.
that gives you already an idea.
Mhm.
All blood dark,
Mhm.
almost bordering on brown, black,
yes.
but fresh blood is very bright red.
Yes.
So people I think can understand
Yes.
that or visualize that when
Yeah.
you say it like that.
Right. And we're saying all of this because we do know there are many people who may be listening to us who have experienced this, maybe not once, not twice, maybe a third time, and have ignored it and have come to their own conclusion on their own diagnosis, saying, well, I believe, or I think, or I ask my best friend, and my best friend would go on Google, and my best friend say, maybe it's a hemorrhoid I have.
Right.
And it went away, it went away, and it didn't come back. But it might be something very, very more dire. And the prevalence of cancer is so high now that you and I cannot take chances, and we cannot assume, because I cannot just look at my belly and say, well, boy, it feels like I feel like I have a cancer, or I don't think I have a cancer, because no one can actually see inside of their own bodies.
Right.
That's
right.
why God gave man the wisdom to create those devices and equipment so that we can get the help to see what's happening. inside of us.
Right. And I'm glad you made that reference too, because some people, because of maybe faith, think, God will take care of it through
Yeah.
the medical process that He has allowed people to be experts in. I heard somebody recently say, and it was disappointing to me, because normally women tend to have good health seeking behavior. That's what we say. But I heard a young woman say, I doesn't go doctor, I'm my own doctor. And I think that's such a
It
dangerous
is a
mentality.
Yeah.
Dangerous mentality. I think, we all should heed this very sage advice, which is, if something is wrong, something is not normal, you're observing something, and we started off by saying, know how your body operates normally, so you can know when there is something abnormal. You seek professional medical advice.
That's very true.
Yes.
That is very,
that's
very
my
true.
ending statement on that.
And really and truly, we don't want you to be ashamed or to be so fearful that you do not seek help.
Right.
You being fearful, basically, it's going to make you more anxious. And that anxiety will subsequently can lead to a depression, right? So we don't want you going down that road when you can simply get the assessment done. You may not be able to afford a private doctor. You go to
the health center.
your primary health system, and you access that, and you get somebody to assess and see what's happening with you, and subsequently you will get the help that is required. Not all bleedings require surgeries. Not all bleedings are cancers. Not all bleedings are life-threatening. However, all bleedings that comes that you would see in the stool is urgent enough to warrant further
Investigation,
assessment and investigation. So we really want you to take this. Those of you who would have listened today, I do hope that the information was relevant. I do hope we didn't even touch on nutrition and lifestyle, but quickly, because the time we're already out of time. Again, if you're a smoker, if you abuse alcohol and drugs, if you are on many medications that we call polypharmacy, you might be taking many medications for different medical conditions, you are more likely to have bleeding in the GI tract, bleeding in your stool. If you've strained yourself, let's say you've got a fall or an injury, physical injury, that could also be another cause. If you are exposed to harsh chemicals, like pesticides and weedicides, and you're using sprays. Let's say you're a sprayman, you're exposed to harsh chemicals, you're not using the occupational health and safety gears. Again, that can put you at risk as well. If your diet is very, very low in fiber foods, so you're not consuming enough fiber foods, whole grains, that predisposes you as well to constipation and colon problems. Again, you are more likely to have bleeding of the stool. If you don't drink enough water, and we're not talking about drinking enough juice, we're saying drinking enough water, particularly now it's very, very hot. We really want to encourage people to drink much more water. I am not a big fan of water in terms of taste, but I'll tell you what, every morning when I get into my office, I buy a large bottle of water. I put the vitamin C sachet in there, and my water tastes delicious, really nice. And so that encourages me to drink plenty water, right? So you can add a flavor, but if you add enough flavor, you want to add preferably an electrolyte in there, something good in potassium and the other key electrolytes, zinc and all of that, that is good for your immune system. So eat foods high in fiber, that is going to help as well to prevent you from developing hemorrhoids, developing constipation, and even aggravating your hemorrhoid if you do have hemorrhoids. Reduce on the alcohol, reduce on the smoking, exercise, that's very, very important as well. Exercising, keep your body moving, be active, and look at the same time on the foods that you consume. It is 11:36 and we have to really end this episode of Health Vibes today. But as usual, it was our pleasure bringing this episode to you. We do hope that you enjoyed, and at the same time, you were very much educated by the contents of today's episode as we discussed blood in the stool.
Yes. And Carlton, I just want to say, to our listeners on radio, and also but our listeners on Facebook who have become quite interactive, through the Facebook page. We appreciate that, and we appreciate the interaction. And I can tell that it was a very informative session for these listeners.
Yes. Thank you so much, callers. And as usual, your health is indeed your greatest resource. Preserve it. Have a good morning, everybody, and remainder of the week. Bye-bye.
Bye-bye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan-Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on